haven't had a lightning strike that would fit on this YouTube channel in a while, but I'm having one now, and it's related to ongoing conversations with a health practitioner, a dentist who I worked with back in 2017, 2018, who we've started visiting again about his work. And so a certain metaphor that used to help me make sense of the world years ago popped back into my head. And it's actually, interestingly enough, the result of some of my own employment experience. And so this metaphor helps me to understand the relationship between different health practitioners and different health disciplines. And I have talked about that on the channel. It's also the place I would assert that you're going to find your most qualified patients from. They come dipped in trust, their compliance is high, their willingness to pay is high, and less likely to sort of be influenced by whether or not insurance covers X or Y. But you already know that. So I used to work at Home Depot, the DIY box store, and I used to think about the struggle that customers in my department would have in articulating their concerns. But I could also see that customers across every department would have varying capacity to understand and articulate their symptoms. So this is not unlike the automotive world also, where people describe symptoms, or professional mechanics speak in causal, sort of like that noise is caused by this, that symptom is caused by this, and the end users are like, well, I don't know anything about that, but I'm experiencing the shuddering, I'm experiencing the wear, I'm experiencing the symptoms. And professionals understand, because of the rigor and their practitionership and the time and the mentorship and well, they've seen enough of it. They're prolific enough that they know not only the symptoms, but they have some understanding about where to look, where to begin investigations, looking into causal stuff. Okay. So the variety in the capacity for people to ask questions that I experienced in the big box store made me think about whose obligation is it to help customers to increase their capacity to ask better questions. By better, I mean questions that involve more causal, holistic type things. Now, in reality, problems with your car and problems with your health are not as tidy as how does Deirdre from Andor talking about Major Partagast's lines that she has been drawn. She's like, do you really think that the rebels abide by these arbitrary lines that were drawn, by the Empire and the other officers? Like Major Partagast drew those lines. Anyways, her assertion is kind of my assertion, which has something to do with that the integration of departments in a hardware store, or some sort of like liaison that would help customers to ask questions that they ought to be asking, but they don't know what they don't know. And because they don't know what they don't know, they're sentenced to ask questions that are cursory and based on symptoms. And they don't know how the departments talk to one another. And then when it comes to health and wellness, what I'm saying is there's an incentive for the disciplines to keep it that way. Why? Because it's profitable, comfortable, and to start mixing disciplines is messy. And yet, here you see people, the patients don't care. The patients who've been given their green sleeves and who have been sent home to die with their garbage pail diagnoses because the cardiologist is not interested in how diet could influence the regaining of cardiovascular function. They're just banging out stints, angiograms, angioplast, whatever. I got to go play golf. Or dentists who are like, go to conferences and talk about holistic wellness. In truth, it's like, you just want to bang out some implants and do chiclet smiles. Or the plastic surgeon who, could be doing cleft palate surgeries or whatever for impoverished kids in the third world. Instead, just cranking out boob and nose jobs. And they're good at it. You can rationalize it however you want. And ultimately, you'll get your opportunity, if you believe in that sort of thing, to be accountable to your maker as to how you used your endowment of talents and opportunity and blah, 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 all that crap. What I'm saying is a lot of answers to you and to your practice in terms of having more qualified patients come as you more tightly integrate and imagine talking to the other departments within the hardware store. What I'm trying to say is, whose responsibility is it? The practitioners or the worker in the plumbing or the electrical or the hardware or the finishing or the paint department? To listen to someone's symptoms and then make recommendations and say the kind of sinister things that all of your associations don't want you to say because they want you to practice chiropractic and they don't want you to be practicing dentistry. They want you to practice dentistry and they don't want you to be practicing medicine. They want you to be practicing medicine and they certainly don't want you to be, in other words, they want you to be prescribing, proprietary, profitable, anyways. I'll close by saying one of the reasons why I like this video in the description the most is that when this gentleman reached a point in his life where he knew that he needed help and he called someone, one of the things that she did, in addition to getting him in her downline to buy shakes or whatever, was to go adopt a shelter dog. And she knew that that alone would address more of the mind, emotions, spirit, in addition to just the body. But so many people exist within their silos and pay lip service to the idea that they're into like integrated medicine and, treating the whole patient. And I'm like, no, I don't think that you are. You look condescendingly down at informed consent, laughably, and think that your patients owe you and your God complex gratitude that you're even taking time out of your busy schedule to listen to them talk about their symptoms. Anyways, the hardware store. That was supposed to be a discussion about the hardware store. Whose responsibility is it? The customer who can hardly articulate with specificity what's going on with their symptoms, or the part of the so-called professional to help them stitch their symptoms to causal stuff that might be going on in another department? Obviously, it is, right? But when associations keep their people, pigeonholed, and I know by necessity they have to do it because you have to have your 10,000 hours and be an expert at something. It's just that what if the thing that you're an expert in isolation isn't going to help people? Clearly it's not. Anyways, rant.